I'm Randall Squires. Can everybody hear me? In the back? And Andrea said she thought I spoke with y'all maybe a couple of years ago. Can't remember, maybe on postmenopause treatment. But as I said, Randall Squires. I'm with Advanced GYN. I'm originally from the coast. Anybody know where Aner is? Yeah. UCLA, Upper Conway, Lower Aner. That's where I'm from. Grew up on the tobacco farm and cotton and all that stuff. But anyway, I practiced on the coast for 10 years, and I've been up here 18 years, and I've been doing OBGYN, which is taking care of pregnant and not pregnant women. And as of August the 1st, I retired from taking care of pregnant women, and I take care of not pregnant women. And my wife, about a week after that, she said, "Where have you been for 30 years? I said, "Well, I've been at the hospital." And she says, "Well, let's get things straight. The 3 kids and I have done everything for 30 years, and we don't need you to tell us how to do it or when to do it, because we know how to do it." And a week later, she said, "Since I'm not delivering, I'm not at the hospital all night." She said, "You know, you ought to think about a hobby." I said, "Okay. Welcome home." So anyway, I'm going to be talking about breast cancer prevention. And just to let you know where I'm coming from, you know, we've always talked about breast and signs of breast cancer and treatment of breast cancer, but we actually now have something that we can do as far as prevention, which is big. And what we're going to be addressing is genetics, trying to determine if anyone has a genetic predisposition to breast cancer, ovary cancer, among other cancers. Now, why is this such a big deal? You know, when I was in medical school, we were quoted the risk of breast cancer, well, the chances of a lady developing breast cancer is 1 in 12. Now we're saying 1 in 8. So it is increasing. And you want to do anything you can to prevent a cancer. You know, my personal story is I had a brother at age 31 that died of melanoma. And that's pretty devastating. My wife is doing well. She's had breast cancer. Her mother had breast cancer. Her grandmother had breast cancer. So we do see it run in the family. And we do know that certain cancers are inheritable. And that's what we're going to be addressing today, inheritable cancers and what we can do to decrease the risk of you developing a cancer. So, breast cancer prevention program. And, this is what happened to me about a month ago. I was at home, my wife and I, you know, I got to keep y'all awake. So about a month ago, we were at home at about 9:15. You know, we have 3 children. They're all adults. They're all gone. So now we have 3 little dogs in the house. And about 9:15, all 3 dogs started barking. And I thought, okay, my son and his wife, which are local, are coming to see us. Nobody drove up the driveway. We didn't see any lights. I said, okay. So our house sits off from the road. The next day, I walked to the mailbox, and I look, and there, I've been rolled. Who have I been rolled by? The nurses in my office. They went out to Los Amigos, and they decided when they got through, let's go roll Squires' yard. And I don't know if y'all know Susan Tate, the salt of the earth, wonderful person, has never done anything wrong. She's afraid she's going to do something wrong. She worries about everything. She would be the last person that we would want to leave the office because she's the best person in the world as far as an employee, as far as a good person. You see the blue tree? She rolled the tree. My nurse drove the getaway car. She dropped Susan and Julie and Mandy off. She didn't even pull in my driveway. That's why I didn't see any lights. She dropped them off on the highway. They ran into the yard. She took off, and Susan the whole time's going, "Oh, the car's gone." And she rolls the tree, and the car's gone. And she's just like so scared. Well, anyway, I didn't know it. Came out the next day. Everything's rolled. So that's the part to keep y'all awake. We're going to be addressing mainly breast cancer and with the emphasis on it. But what I'm going to be speaking about is an hereditary syndrome, which is called hereditary breast and ovarian cancer syndrome. And the two main cancers that are involved in it are breast and ovary that can be inherited. And if you have certain red flags in your family, then you are a candidate to be tested to see if you have a genetic defect that can cause this cancer. Bottom line is, everybody has cancer cells. Everybody has cancer cells, but everybody doesn't get cancer. Cancer manifests itself when it appears as a growth, or it affects your weight, or it causes a problem. But everybody's got microscopic cancer cells, and we have cells that fight those, so that those cells never make a mass. They never present themselves as cancer. Those are called tumor suppression cells. So everybody's got cancer cells, everybody got cells that fight them, and most people, the cells fight and they never get cancer. What I'm talking about is a defect in the gene of that cancer cell, so it can't fight cancer. So everybody's got cancer cells, everybody's got cells that fight them, but some people, their cells don't work and they develop cancer. And the red flags to us is that if someone has a defect in that cell, are certain things: family history of breast cancer before age 50, a family history of ovarian cancer, a family history of male breast cancer. These are some of the red flags, and and my patients, when they come in, I do a screen on all of them. I determine if they qualify for genetic testing. If they do, we do the genetic testing. It takes about 6 weeks to get back, and then I sit down and I go over with them the results of the test. If it's positive, we have a protocol. If it's negative, we have a protocol, and I'm going to go over that with you. But try not to get too bogged down in details, but just realize what the concept is. The concept is identifying people that are at risk of having an inherited cancer and what we can do to decrease the chance of them ever having the cancer. So what about? What about me? That's the question my daughter asked. You know, my wife was diagnosed with breast cancer, or golly, it's been about 10 years. And, you know, scariest thing you've ever had in your life. I mean, really, we were both off one day. Her mobile phone rang and she said, they said there's something on my mammogram and they want me to come back sometime. I said, well, tell them as fast as we can get there, we'll be there. So we got it. 2 days later, we had a diagnosis. You know, you never forget stuff like that. All she did was she called me at work and she said, it's it. You know, you can't even say the word. And, you know, she's done fine. She had lumpectomy, she had nodes, she had chemotherapy, and she's doing good. But we talked to her, you know, you don't even know exactly where you're going or what you're doing, but we both came home from work and talked and cried. And we said, well, you know, we're going to talk to our kids. You know, they're all teenagers. And my daughter and 2 sons. And this is my daughter and her husband. But after we talked about everything, Lee said, what about me? And you know, at that point, I couldn't tell her what about me, because 10 years ago, we didn't have, the testing was not as well known and as well used. Now my daughter's an adult, she's married, I've told her everything I'm going to tell you, and she can make that choice. Does she want to find out if there is a genetic defect in our family? And if there is, then she will have options of how to prevent it in her. And the options we have are basically 3 things. We can watch you closer, we can give you medicine to decrease the risk, and we can do preventative surgery. And those are the keys. Watch you closer, give you medicine to decrease the risk, and do preventative surgery. And of course, it's what about you? So it's what about me when Lee asked that question to me, but now this is what about you? And that's what we want to do, is we want to design a cancer prevention program for any patient that has a risk factor, that be it they have the defect or not, regardless of if they have red flags in the family. If somebody comes in and they have a red flag that tells me they qualify for the test, If it comes back positive, I can tell them what to do. But also, if it comes back negative, we have protocols, because we put people into 3 groups: low risk, high risk, moderate risk. Low risk, no family history. High risk, positive family history, and they got the defect. Moderate risk, where so many people are, they got the family history, but they don't have the defect. What do? You don't watch them like you do ordinary when somebody doesn't have any risk factors. You don't watch them as close as you do if they have the defect, but we actually have a protocol of how to watch them and what to do with them to help them to prevent cancer. This is my wife and me, you know, country people, but of course, my daughter got her master's in international business in Arabic. So 2 months ago, we went to a Sikh, Hindu, Buddha wedding in a temple in Queens, New York. And the day before, we wore Nepali attire, which was Buddha Hindu for the bride. And then the next day we wore Sikh attire, which is Indian attire for the Sikh religion. And I just have to tell you the Sikh story. I may have told y'all this a few years ago. So my daughter decides she's going to get a master's in international business in Arabic. Of course, you know, we're scared to death. We don't want to go over there and all this stuff. And they orient her when she goes over to, she was going to Nepal at this point, and they oriented them in India. And she walked out of the hotel during the conference, and she ran into this guy that had his hair up in a thing with a turban. And she says, "How are you?" He said, "I am Sikh." She said, "I'm sorry." He says, "I have been Sikh all my life." She said, "Oh." He said, "I go to Sikh temple every day." And she says, "Oh," as she's stepping back. And then she goes into the hotel and she runs into these other people. My daughter, you know, she goes to India, Nepal, and all these places. She never got on a plane, you know. And she said, "Oh my gosh, I ran into a sick man out there, and I washed my hands all about to my elbows. And I wondered, do y'all have any of that soap that you squirt on your hands?" And the lady said, "What?" She said, "He was Sikh. He goes to the Sikh temple. He's been Sikh all his life." And the lady says, "Lee, Sikh is the religion of India. So you're not going to catch anything." So what can we do? First of all, like I said, Andrea, what is my time frame? 105? Yeah. Oh boy, I got to hit it. We get your personal history. What's your history? Have you had breast cancer? Have you had ovary cancer? Have you? This is also associated with some other cancers: prostate, melanoma, and pancreatic cancer. What's your history of cancer? What's your family history? We then collect a test, which is just gargle with scope, spit in a cup. And another way we can analyze you is do a computer analysis. We can throw your family history into a computer, and it'll tell us what your 5-year risk of breast cancer and what your lifetime risk of breast cancer is. And based on that, we can make recommendations. So we can make recommendations based on history, based on computer, based on a positive, a negative test. There's just a lot of protocols, and it's very individual for each person that we see. So what's this based on? The older you are, the higher the chance of getting one of the number one risk of breast cancer is your age. The older you are, the higher your risk. What is your race? Black ladies tend to have a more serious breast cancer than white ladies. What's your physical activity? Do you drink alcohol? There's an association. Do you smoke? There's an association. Diet, fatty food increases your risk. Have you had a bunch of breast biopsies? If you've had, you know, several breast biopsies, depending on what they showed, it may increase your risk of breast cancer. What's your medical history? What medications have you been on? There are, you know, estrogen and combination hormone therapies that after a certain length of time can increase breast cancer. And medicines. So we review your family history for those 5 cancers I talked about, especially breast cancer before 50, breast cancer in both breasts, a man with breast cancer, any age of ovarian cancer. Y'all know, I know y'all know Angelina Jolie. Yeah, Brad's girlfriend, wife. Anyway, right? Brad Pitt. Anyway, her mother had ovary cancer. Angelina was tested for the syndrome I'm talking about. That put Angelina at an 87% chance of developing breast cancer. The routine risk is 8%. So she had her breast removed and she had reconstruction. And it also puts her at a 44% risk of ovary cancer. And the routine risk of ovary cancer is less than 1%. So she's going to go back and get her tubes and ovaries removed. Fortunately, it's been shown with the ovary cancer, the chance of developing an ovary cancer before the age of 35 to 40 is less than 1%. So people that have this genetic defect, you know, we tell them, have your children. But when you finish having your children, and at least by age 40, get your tubes and ovaries out. And you're saying, well, get your tubes and ovaries out, you're talking about breast and ovary cancer. Well, we know that by removing your ovaries, you decrease your risk of getting breast cancer by 60% with this syndrome. Why do you get your tubes out? We've now figured out over the last 3 years that probably ovarian cancer starts in your tubes. So we think ovary cancer probably doesn't start in your ovary, it probably starts in your tubes. And we're even now thinking about, okay, you know, ladies have their babies and they have a tubal. Should we just, instead of tying their tubes, should we take their tubes out as a prevention for breast cancer? He hadn't gotten that far into it yet that we know that that's the appropriate thing to do. But it may be heading that way, that when we do a tubal on somebody that's had a baby when they're 28, if they plan to have no more children, they want a tubal, instead of clipping their tubes, maybe go ahead and take their tubes out, because we know that by taking their tubes out, we decrease the chance of ovarian cancer. And believe it or not, it's something as simple as, you know, a lady ovulates every month. The egg comes out, you know, everybody laughs at me. My chest is the uterus. I'm a gynecologist, you know. My chest is the uterus. My arms are the tubes. My hands are the ovaries. Well, ladies before menopause, one of their ovaries releases an egg. And it breaks through and it releases it. And when it releases it, the egg comes out, and then if it drops into the tube and it comes up here and the sperm comes up here and they get together, you're going to get pregnant. But when the egg is released from the ovary, we now know that there's a chemical released from the ovary that can be deposited on the tube, and it can cause cancer. And that cancer in the tube can in turn into cancer in the ovary. So, you know, it's a pretty simple concept, but they've been studying this for about, well, they've been studying it a long time, but the literature's coming out this year about ovarian cancer probably starts in the fallopian tube. I forgot my belt. When Andrea called me today, first thing I thought is, I forgot my belt. And then the second thing I thought of is, I don't have a car. My wife's car was goofed up, and so she dropped me off, and so, you know, somebody's going to, anyway, my nurse brought me here. So, without a belt, she said, go borrow Dr. Warren's belt. I said, Dr. Warren's about this big around, and I'm not that big around. And the whole time, I didn't say anything to Dr. Warren. The whole time, when I'm getting ready to walk out, I don't know if y'all know Dr. Warren, but he talks a lot. And so, I'm like, Angie's in the car getting ready to take me, and my one foot's out of the door, and Dr. Warren's going, and I see he's looking right here, mid-waist. And I thought, you're looking because I don't have a belt. But, you know, what can I do? Okay, so breast, ovary, pancreas, melanoma, prostate. Big risk factor, Jewish. Most people that are Jewish in the United States are Ashkenazi. Is that right? Ashkenazi Jew. Most Jewish people in the United States are Ashkenazi Jewish people. They have a founder mutation. They have a very high incidence of having this defect. So anybody that's Jewish in the United States is a candidate to be tested for this defect, just by virtue of them being Jewish. That's my mushroom, you know, I took a picture. That's what an iPhone. That's not even a fancy camera. Genetic defect. This is called hereditary breast and ovarian cancer syndrome. Is it 10 to 1 or 1 after? Yeah, it's 10 to 1. Okay. Hereditary breast and ovarian cancer syndrome. You gargle, spit in a cup. It determines if you have inherited breast cancer, determines if you can inherit ovarian cancer, but it also determines if you can inherit pancreas, melanoma, or prostate. So we get the test back, or you say you don't want the test. So I get a test back and it's negative. Or you say, I don't want the test. Then I say, well, let's do a computer analysis. And I can tell you your risk of breast cancer, even though you decided you didn't want to have the test or the test came back negative. And we'll put in your personal family history, and it'll tell me your 5-year and your lifetime risk of breast cancer. And based on that, I can also design a cancer prevention program for you. I see men too. I won't check you, and I won't put you in the pelvic room, you know. But I do see men, and I do counsel them, because I also do testing. What I'm concentrating on today is breast and ovarian cancer, but there are 2 other cancer syndromes that are inherited also. And one's called Lynch, and that's associated with colon cancer and ovary cancer, among other cancers. And then another that's associated with a bunch of polyps. But the main thing about these inherited cancers I did not point out, most of them, if you have it, there's a 50-50 chance you'll pass it to your child. Yeah. So, you know, if you say, well, you know, my Aunt Martha had breast cancer before age 50 and her sister had ovarian cancer and nothing's wrong with their kids. Well, there's a 50-50 chance. And just because you have the gene doesn't mean you'll get it. I mean, there's a 44% chance you'll get ovarian cancer, but there's a 56% chance you won't. So, if somebody decides to have the test or not. If they don't, I do the computer. If the test is negative, I do the computer. And based on the number they get on the 5 and a lifetime risk, I can present to them a cancer prevention program. She drove the getaway car. She wrapped the purple stuff.
Got some good friends.
Yeah. Oh, yeah. And I went out with them. You know, I left my old office and to come to the new office, and so we get together about once a month. And so we went out a couple of weeks ago, and I go out with them. They said, "Los Amigos?" I said, "Yeah." They said, and we got almost halfway through. They said, "Susan's out of town. We can roll her yard." And I said, "No." I didn't tell you, 2 years ago they rolled my yard, and the time we pulled up in the front yard, my wife said, "This was done by professionals." I said, "What do you mean?" She said, "This is not by kids." She said they meticulously put it around every tree. They even had a finish line between 2 trees, so I'd drive through it. And when we pulled the tissue out, it was 3-ply. It was the good stuff. I could even, you know, when it's up in the tree and you try to get it and it breaks this far from your hand, I could twist it and it would pop off at the limb. It was good stuff. But I was not participating in the yard roll 2 weeks ago. Okay, so what the doctor did, we reviewed your history, you and your family history, we did the test, and we talked to you about the genetic test, or we talked to you about the computer test. And another iPhone photo. And as I said, bottom line, you're in a low risk, moderate risk, high risk. Low risk, routine stuff. High risk, you got the gene. Moderate risk, you got the family history, but you don't got the gene, or you decided not to get tested. iPhone shot. What flower is that? A red hot poker, right? Isn't that what you call it? Oh, come on. Yeah, that's what it is.
Got any cuttings?
Got any what?
Cuttings of it?
You know, my sister-in-law gave this to me. And
Pretty.
I grew up on the coast. I never saw them until I came up here. But anyway. And they multiply. Okay, well, that's as big as it is this year.
It's pretty.
But I'll bring you some next year.
Okay.
So what we do is we develop a personal breast cancer prevention program for whomever I see, based on their history. That allows us to watch you closer, to give you medicine to prevent it, and to do surgery if we need to. So I'm going to divide these three categories in: watching, medicine, and surgical prevention. And it's how do we decrease your risk? We can, and you check your breast every month. You get a doctor to check your breast every year. But if you're in one of these higher categories, we check your breast twice a year. You get a mammogram. But if you're in one of these higher categories, instead of waiting until age 40 to get a mammogram, you're going to get one at age 30, probably. And they even talk about possibly earlier. And how are we going to watch you closer? Somebody that has the defect, we get MRIs on them. And MRIs, okay, how sensitive? MRI's better than a mammogram. A mammogram's better than the doctor checking you or you checking you. So why don't we get an MRI on everybody? We don't get an MRI on everybody. First of all, it's not the gold standard by the medical societies, and mammograms are the gold standard. But we do get them on people that are high risk. They pick up the cancer earlier, but the not good thing is they have a lot of false positives. And you know, in medicine, you know, everybody talks about cost, and obviously we talk about patient anxiety. And so on the good side of the coin, they pick up breast cancer earlier. On the other side of the coin, a lot of people have biopsies that are negative, which is good, but they, you know, anybody's going to worry if they tell you need to have a breast biopsy. So it's been decided that breast MRIs are indicated only for certain situations, and those situations are people that have the defect or people that have a lifetime risk of breast cancer of 20%. So that's what we do to somebody that's in the moderate or high risk. Breast exam on themselves monthly, us twice a year, mammogram once a year, started earlier if they have the gene. An MRI, start them if they have the gene. And we do an MRI and a mammogram. So we do them once a year, like in January get a mammogram and in July get an MRI, so you have one every 6 months. One thing I failed to tell y'all, because you qualify for the genetic test, and I recommend it, it does not mean your insurance will cover it, unfortunately. But when I started doing it about 2.5 years ago, we had about a 50% coverage. Now it's about 80%. So genetics is a big field, and insurance companies and everybody's really recognizing the significance of genetic testing and what it can do to help prevent disease. And so it's gone from 50% coverage to 80% in 2 years, and they're becoming much, much more liberal and covering the cost. What medicines? We have 2 medicines that we can give to people that are at high risk to prevent breast cancer. And they can prevent breast cancer anywhere from about 40 to 60% of the time. That's pretty big. First one's tamoxifen. Everybody goes, tamoxifen, oh my gosh, that's the one that the people take that had breast cancer. Yep, it is. But it's the one that you can take to prevent breast cancer. And I know everything has risks and benefits. Fortunately, my wife, you know, she had chemo radiation, lymph node dissection, and then she was on tamoxifen for a while. But tamoxifen, but look on the good side, tamoxifen lowers your cholesterol, which is a good thing. Now there are risks associated with it, but tamoxifen decreases breast cancer and it lowers your cholesterol. What else do we have? Avista. You know, everybody's big on bone density and making sure your bones are strong. And Avista is one of the medications that we give people to decrease the risk of brittle bones. But now we found out a few years ago it decreases breast cancer, which is wonderful. So when I'm talking to people, when I say, you know, you've got the gene or you have enough risk factors that you qualify, it's a whole lot easier to get them to take Avista because it helps your bones. And you know, it's not associated with the stigma of tamoxifen of you having breast cancer. But I do have a lot of people that are on Avista as a prevention. And also it helps your bones. And I have quite a few people that are actually on tamoxifen too. But if you realize if you can cut your risk of breast cancer in half by taking a medicine and you accept those risks, whatever they may be, you know, tamoxifen can cause hot flashes too. Nobody wants hot flashes. Avista can cause hot flashes. Now, this is pretty dramatic. The surgery. The surgery is for somebody that has the gene. And if somebody's got the gene and they have an 87% chance of developing breast cancer, they have the option of having a mastectomy. But unfortunately, it doesn't decrease it to 100%. You would think, okay, you take your ovaries, your breast out. I mean, what can happen? Well, you can't get every tiny cell. It decreases the risk of breast cancer by 95% to have a mastectomy. And as I said, people who have the gene, if you take their ovaries out, it decreases the risk by 60%. So that's a good thing. Another thing just to mention to you, not to confuse you, but just to tell you, people that have this gene, to decrease their risk of getting ovary cancer, birth control pills decrease the risk of ovarian cancer by about 60%. And you know, you take them when you're younger, but it holds. It holds for years thereafter. And if you think about it, I told you that ovary cancer starts in the fallopian tube, and if you're on birth control pills and the egg doesn't come out of the ovary and that chemical doesn't get splashed onto the tube, then it decreases ovarian cancer. So not ovulating helps prevent ovarian cancer. But it also decreases, not having ovaries decreases breast cancer because there's the decreased estrogen amount. So people that have the gene, they can have mastectomy, decrease the risk by 95%. People that have the gene can have their, I should have put tubes and ovaries removed, and decrease the risk by 95%. And you say, okay, give me a break. You know, 95% again, why not 5? Believe it or not, there's a type of cancer that can grow in your pelvis from the lining of your pelvis. That's the type of ovarian cancer that you can get even if you don't have ovaries. It's rare. I mean, really, find me some wood. I've been in practice 28 years. I was in training 5 years. I hadn't seen anybody get that kind of cancer. That's my son. This is my youngest son. He is in Columbia, you know, living the life. He's not married, and and this is my wife, my beautiful wife. That's Ben. This is my other son, Matt. He works with an engineering firm, and you know, what does this boil down to? Why do you do what you do? You do what you do because of your family. Everything's about your family, so you can be with your family and they can be with you, and that's everything. You know, sounds cornball, but your family is everything to you. But this is my other son, Matt. This is one of my daughters. That's his wife, Courtney. She doesn't like me to tell people because I tell stories about her, but she's a second grade teacher at West End. This is one of my other daughters. This is Manachi. Manachi is from Nepal. And when my daughter was at Converse, believe it or not, little Converse, they have all these people from all over the world. 3 minutes, I'm gonna finish. Manachi's from Nepal, and she's become a daughter to us. She's been here about 10 years. She's only gone back to Nepal twice. When she graduated Converse, her family came and stayed with us, her mom and dad. I didn't know what they were saying. They didn't know what I was saying. But, and then I have to tell my Manachi story. Hopefully y'all hadn't heard it. So we're going to a wedding in a couple of years. She calls me dad and calls Cindy mom, and she expects the same present for Christmas that the other kids do. And she's going, I'm going to a conference in 2 weeks to Atlanta. She said, God, great, Dad. Mom and I'll go with you. We'll go shopping. You give me money. I'm a poor student, graduate school, Wake Forest, no money. I said, okay. Well, anyway, so we're going to a wedding, and we're in the minivan, you know. And I'm in the front with my wife, and my son and his wife are in the back, and Manachi's in the very back. And I say, Manachi, it was awful last weekend. Mom empty nested all weekend long. We were by ourselves. It was horrible. Dad, that's not very nice. And I looked back at Matt and Courtney, and I said, she didn't know what I'm talking about. In Nepal, you know, culture gap. I said, Manachi, what does empty nesting mean? She said, farting? I said, no. I guess, you know, empty nest, fart, I don't know. I told her last night on the phone I was going to tell this story the next time I spoke. And she said, Dad. She said, remember, Dad, we are going to Atlanta. You give me money, okay? I said, yeah. And this is my daughter, Lee. She got a master's in international business in Arabic. She married this dude from California. And anyway, they're up in D.C. And and so what do I want? All I want is for you to be okay. And that's another iPhone photo. Y'all got any questions? Hey, 30 seconds.